What to do if you have COVID. If you test positive for COVID, you may spread it to others, even if you do not have symptoms or if you're already vaccinated. It is important to separate yourself from others or isolate if necessary and follow the recommendations listed below. Separate yourself from others or isolate. Stay home and away from others for at least 5 days after your symptoms have started. If you do not have symptoms, still stay home for 5 days after the date that you have gotten tested. Even if you are fully vaccinated, we will explain more related to how long you may have to stay home below. Wear a well-fitting mask when you need to be around other people, even in your own home. Stay in a separate room from others in your household if it's possible. Use a separate bathroom if you can. Take steps to make airflow in your home better if it's possible. Avoid contact with members of the household as well as pets within the home. If you are an older adult or have a weakened immune system or other certain medical conditions, make sure to let your provider know that you have contracted COVID-19. They may recommend treatment or have specific advice for your health conditions. Tell people who you have had close contact with that you have been exposed to COVID-19. How long should you stay home? If you are an individual who can wear a well-fitted mask, wear that well-fitted mask at home while around others for a total of 10 days. If you have symptoms, stay home until all 3 of these things are true for you. If it has been 5 days since you first felt sick and you have had no fever for at least 24 hours without using any medication that helps to lower fevers, and you feel better. If you have COVID with no symptoms, you should stay home and away from others for 5 days after your test date. If you do later develop symptoms, you must count your first day with symptoms as your new day 0. After your stay-at-home period ends, continue to do the following for another 5 days. Continue to wear a well-fitting mask even in your home. Do not be around others who are at risk for getting very sick from COVID-19. And do not go places where you will need to take your mask off, like gyms or restaurants. Avoid eating near others at home or at work. Avoid travel. If you must travel after your stay-at-home period ends, wear a well-fitting mask. So filling in your information to know when you can go back to your normal activities. If you have symptoms, my symptoms started on, fill in the date. I feel better and I have been fever-free for 24 hours. I still need to stay home and away from others through 5 days after my symptoms have started. I still need to wear a mask around others and limit some activities until 10 days after my symptoms have started. If you do not have symptoms, fill in the information. I tested positive for COVID-19 on, fill in the date, but I do not have any symptoms. I still need to stay home through 5 days after the day I got tested. I need to wear a mask around others and limit some of my activities until 10 days after my test date. For those individuals who are unable to wear a mask, this group includes people under the age of 2, people with specific disabilities, and others who cannot consistently wear a mask around other individuals. You should stay home for 10 full days, at least from when you first felt sick or the day that you were tested for COVID-19. People with a weakened immune system or who are already severely ill. This group includes individuals who are hospitalized or required intensive care or ventilation support and people with compromised immune systems. Those individuals should stay home for at least 10 days and potentially up to 20 days. Also consult with your healthcare provider. Wear a well-fitting mask, and you may require a viral test to determine when you can be around others again. If your symptoms become worse, or you have difficulty breathing, or you need medical care, contact your healthcare provider. Make sure you call ahead. Do not use any public transportation or ride sharing, which is an example of Uber or Lyft, or any taxis if you need to go to a clinic or hospital. If you need emergency medical attention anytime during your isolation period, call 911 and be sure to let them know that you have tested positive for COVID-19.